Welcome back to part 15 of training muscle lengths, the low back. As you can see from this figure, there are a ton of little nitty-gritty muscles on the backside of the torso. We're going to focus on these three big ones here, the spinalis, the longissimus, and the iliocostalis, which collectively we refer to as the erector spinae muscles, or erectors for short. Each of those muscles are divided into three sections. The spinalis and longissimus will have a capitis section, a cervicis section, and a dorsi or thoracic section. And the iliocostalis has a cervicis portion, thoracis portion, and lumborum. Now that sounds like a lot, but when we train these, we don't really differentiate between the portions of the muscle and really between the muscles themselves at all. This figure has them all nicely separated, but on a real person, they all sort of blend together. All you really need to know is that they run along the length of the spine, and they're connected to different portions of vertebrae and ribs all the way down to the hips. As far as their function, in this case we're talking about what happens at the spine, so this is a new figure that we haven't seen in the series yet. Now along with the other trunk musculature, more so thinking like abdominals and obliques, they do play some role in rotation, and when all of one side contracts we get lateral flexion. But for this video, and actually for the next video on the abdominals, we are most interested in flexion and extension. Now we should acknowledge that there are different portions of the spine. We have the cervical up top, the thoracic or T-spine in the middle, and the lumbar, or what you probably think of as low back, at the bottom. Plus the sacrum and coccyx, but those bones are fused. Now these portions of the spine can move independently, so think of somebody like twerking, for example. That motion is not happening up in the cervical or thoracic spine, or at least it shouldn't be. Our ability to twerk happens at the lumbar spine. So looking back at this figure, the erectors cause extension, and we are mostly interested in thoracic and lumbar extension. So the erectors will be shortened in extension and lengthened in flexion. These CrossFit back extension pictures are actually perfect for what we want to talk about. So a flexed spine, we have lengthened erectors, and extended or even hyperextended, we have shortened erectors. Now note that the erectors do not cross the hip joint, right? So they don't cause hip extension. So if we look at these two images here, really the motion should be all occurring about the spine, not about the hip. Versus here where you'd think, oh, is this all flexed? No, the hip itself is flexed, but if you look at the spine, it's actually extended, which means the erectors are shortened. In general, if we're trying to change the emphasis of a back extension between the erectors or the glutes and hamstrings, we would change where the pad contacts us. If the pad's below the hip, most of the motion will probably occur at the hip. And if it's at or above the hip, most of the motion will probably occur at the spine. Which brings us to the reverse hyper, which is one of my all-time favorite movements. If we let this pendulum swing with a little momentum, it'll really pull us into spinal flexion for some nice lengthened erectors and shortened at the top.